Thank you for joining the National WIC Association's 2021 Hill Briefing, the State of WIC. I would like to introduce our moderator and host, Brian Dittmeyer, NWA Senior Public Policy Counsel. Brian, take it away.
Distinguished staff. We have been able to operate and modify our services over the course of 2020 through the use of USDA approved waivers that were authorized under the Families First Coronavirus Response Act. This is the first time that WIC has truly had waiver authority, and so it's been absolutely instrumental to allowing our staff to continue to do their jobs, ensure uninterrupted benefits, while also looking out for the safety of clinic staff and their participants. As we look ahead, we know that 2021 can be an inflection point in WIC program history and our ability to reach families and shape healthy outcomes. The American Rescue Plan that's currently being considered by Congress includes two important provisions that have garnered bipartisan support. The first is enhanced benefits for WIC families. As I mentioned earlier, WIC's foods are nutritious and aligned with scientific recommendations for the specific nutrient intake that pregnant and postpartum women need for healthy pregnancies and that infants and young children need to grow. So the enhanced benefits that are being offered include bumping up the value of WIC's fruit and vegetable benefit to $35 per month for a period of 4 months. And we see that as critical to increasing access to healthy foods while also relieving some of the burdens on fruit and vegetable producers, our trusted partners in delivering healthy and nutritious foods to families. That provision had been championed as early as May 2020 by Representative Kim Schreier and the late Representative Ron Wright. We also know that there's support for dedicated multi-year funding to expand WIC outreach efforts and program modernization to help bring WIC into the 21st century and make the program more accessible. It's critical that that funding is provided through the American Rescue Plan so that WIC can get to work in stepping up our technology imprint and making services more aligned with the other public health services and other programs that our families have accessed in order to obtain health care. And that provision was an investment which was championed by the Biden-Harris White House, was also included in the Republican proposal by 10 senators as they met with President Biden and Vice President Harris in the Oval Office and discussed nutrition priorities. And so we know that there continues to be broad-based bipartisan support for all of these important WIC provisions, both here in the American Rescue Plan, but in our long history of improving the program and moving into a future service delivery model. I also want to highlight one further opportunity that we will see in 2021 here in Congress, and that will be child nutrition reauthorization. And we see some early enthusiasm by the Senate Agriculture Committee to move that priority forward over the course of 2021. And we stand ready to assist your offices as we look forward to moving a CNR bill through Congress this year. So now it is my honor on the next slide to introduce our distinguished panel of WIC experts who will walk through how WIC works and how we've adapted during the COVID-19 crisis and lay out some opportunities for us to all consider as we look forward to a future WIC model that is truly embracing the technology and the accessibility of the 21st century. Our first speaker is going to be Shannon Whaley, the Director of Research and Evaluation at PHFE WIC in Los Angeles, California. And in her over 20 years of service in WIC, Dr. Whaley has been an instrumental part of moving a lot of the WIC-oriented research forward and has sat on USDA panels to review the WIC food packages. Next, we'll hear from Peggy Truba, who is the WIC program manager at the Nebraska Department of Health and Human Services and has a long record of service to the Nebraska WIC program. And then we'll hear some local perspectives from our frontline providers, starting with Safa Hamad, the WIC program manager at the Wake County Human Services in Raleigh, North Carolina, and then rounding out our panel with Lexi Stoneking, a WIC registered dietitian at the Polk and Dallas County WIC programs in Des Moines, Iowa. So we'll get started with Dr. Whaley. Thank you.
Thank you, Brian, for that wonderful introduction. I'm really excited to be here this morning. I'm only sad that we're not all in a room together. Obviously, that would not be wise right now, but I really look forward to the time ahead when we can all convene and talk about WIC, where I can see your faces. So I'm going to imagine smiling faces all across the country as we sit in this Zoom room together. So I'll be talking about the health and economic impacts associated with WIC investments. This would be a 3 to 5 hour talk, and I'm going to try to do this in 12 minutes. So fasten your seatbelts, because this is going to be the 40,000, way up in the sky view, and I'm going to do my best to anchor you in what we know about the real strong scientific impacts of the WIC program on the children we serve. Before I go to the 40,000 feet, I feel that I have to anchor you in where I have been in Los Angeles County for the last year. So next slide, please. This slide shows you what has been happening in Los Angeles County with WIC caseloads since 1 year ago when the pandemic started. We have 7 wonderful local agency WIC programs in Los Angeles County, run by 7 dynamic women who have just learned to, the word of 2020, pivot and figure out how to deliver WIC remotely. We started WIC service delivery remotely for the first time in March, obviously, of 2020. You can see what happened with participation in Los Angeles County over the past year. We're serving 23% more people than we were a year ago. I think this is so important that we've been able to do this. And I thank all the frontline staff and directors, everyone really across the country. I think what we're seeing in Los Angeles County is an example of what has happened over this last year and how we've been able to meet the growing need for WIC. Next slide, please. So what has happened in this last year in Los Angeles County? This increase was really driven by certifications and recertifications of children ages 1 to 4, which is a group we had been sort of losing over these past years. Our daily recertification events increased by nearly 150 events per day. This was a big increase. And remember, this was right after we closed our doors to live services. So it was quite a time. And I really, again, thank the frontline staff for being able to do this. Why were we successful? Brian touched on this a minute ago. That has to do with federal waivers. This would not have been possible without federal waivers, allowing for the waiver of physical presence and the waiver allowing remote issuance. Those two in particular have been essential, and I want to encourage those to stay in place for as long as possible. Frankly, I think they should stay in place forever, but we absolutely cannot tinker with this while it remains challenging I don't want to bring pregnant women into WIC centers anytime soon. The crisis from COVID is much too high. And I think this has given us the opportunity to see how successful WIC can be remotely. These waivers must stay in place. And second, technology. We need to continue to invest in technology, because the reason we have been successful for this last year has been because of our optimal technology. That includes interactive texting, it includes the ability to remotely load benefits, and it includes online education opportunities, just to name a few. So please, it's very important to consider national federal investments in technology for WIC. Next slide, please. So we're going to head to the 40,000 view now. And for those of you for whom that is not satisfying, I'm one of those people, I'm giving you 2 resources where you can do the really deep dive and spend hours and days of your life really learning about WIC, and I hope you will. And feel free to email me. I'll be happy to join you on that journey. On the left is the National WIC Association's State of WIC report that was just released last week. It is a delightful report. I really recommend you download it. It has everything you're going to need for impact of WIC and all sorts of advocacy strategies. It's a dynamite report. Please download it and read it. And the second one is from the Center on Budget and Policy Priorities. Our fabulous friends there put together this terrific piece about how WIC works, and they just updated it 2 weeks ago. So for those of you wanting real detail, please download these wonderful resources. Next slide, please. Let's start with pregnancy. That's where WIC starts. We serve pregnant women, postpartum, infants, and children up to age 5. We know that women enroll in WIC very early. Almost 90% of women enroll in their first 2 trimesters, with the majority enrolling in the first trimester. This is really important. WIC starts early, has a nice big dose during that critical period of pregnancy. What we see is that WIC participation during pregnancy is associated with much healthier birth outcomes, both for baby and for mom. So we see higher average birth weight, we see lower incidence of low and very low birth weight, lower rates of prematurity, lower rates of infant mortality, lower rates of preeclampsia in women, as well as lower rates of excessive gestational weight gain. Again, this is just a few of the impacts, but some of the most important. Next slide, please. And what does this mean? Cost savings are dramatic in their association with prenatal participation. What we, back in graduate school, I actually read Barbara Devaney's 1992 paper with awe, and I got to meet her, which was one of my highlights. She is from Mathematica. They did a study back in the late 80s, collecting data from WIC and from Medicaid, and documented that for every dollar spent on WIC during pregnancy, it conferred Medicaid savings of $1.77 to $3.13. So from the beginning of my now 22-year career with WIC, I have loved citing this study. I think it's just so essential. But every year we get away from 1992 is another year that Medicaid has changed a lot and WIC has changed a lot. So we felt some burden to really look at replicating this study. And I was so fortunate to work with Rock Mianago, who's now faculty at UCLA. He was a graduate student at the time. And we did a system science modeling project, and I'm going to let him tell you more about that because that's not my expertise. But in redoing the data with current data from 2015, 2016, we see still every dollar spent on WIC during pregnancy results in mean savings of $2.48. If spending $1 on WIC saved $1, it would be worth it. Spending $1 on WIC and saving $2.48 is absolutely worth it. It's a very smart investment, and this money goes a long way. Next slide, please. So then children who participate in WIC can stay on WIC till age 5. I would actually argue that in child nutrition reauthorization, we really look at keeping children on till 6 because there's a gap. Children turn 5 before children start kindergarten in most cases. So we really need to basically fill that gap. But children who participate in WIC are more likely to be up to date on their immunizations, more likely to have access to healthcare in a medical home, lower rates of anemia, improved cognitive development, academic achievement, and lower rates of obesity. So these impacts really touch multiple parts of a child's life. Next slide, please. It's WIC. We are a nutrition and breastfeeding program. Have to talk about this. So breastfeeding rates of WIC participants have increased by 43% since 2002. Investments in peer counseling remain important and must continue. WIC food packages are the cornerstone of the program. Brian touched on this earlier. They are aligned with nutrition science and the dietary guidelines for Americans. They meet the specific nutrient needs of women and young children. They are really an essential part of WIC. The notable positive changes since the 2009 revisions to the food packages, that's when fruits, vegetables, whole grains were added to the package. That has been shown to improve access to and intake of these healthy foods, and has also been associated with declines in childhood obesity. Next slide, please. Nutrition education is a cornerstone of the WIC program. WIC is not just about food, it's about food and education. Every family receives education every time they come. Data from the National WIC Infant and Toddler Feeding Practices Study 2. This is a national study in 27 states that's currently going on, following families from the prenatal enrollment into WIC, actually all the way to age 9. We've just finished the 6-year data collection. But what these data show is at age 4, 70% of WIC caregivers report that they changed their feeding practices because of something they learned at WIC. Nutrition education, information, and advice families receive from WIC is rated as important to them as the food they get from WIC. So WIC is a food program, but it's also a wonderful, supportive nutrition education and breastfeeding support program. Next slide, please. Actually, my last slide. We absolutely need to always keep equity at the front of our minds. Promoting equity is actually inherent in WIC's purpose. Our purpose is to improve nutrition of pregnant, postpartum women, infants, and children who are low income. So our goal is to increase equity. What the chart on the left shows you, and these are data from 2018, national data of all participants, you can see that nearly 2/3 of the individuals served by WIC live in households with incomes less than 100% of the federal poverty level. So in order to ensure equitable access to healthy food at critical periods of development, and I would argue pregnancy and early childhood is the critical time, we must invest in high quality, nutritious foods for those who are unable to afford it. Frankly, as Brian talked about earlier, fruits and vegetables are out of reach for many low-income families. They are too expensive. So now is the time to double our investment in WIC's food package and to increase access to healthy food for those who need it most. This is an equity issue, and we know from the public health literature, the gap between the wealthy and the poor leads to poorer health for everyone, not just the low-income families. So we have the science, we have the evidence base in the 2017 recommendations from the National Academies of Science to increase fruits and vegetables as well as other healthy foods. Now is really the time to double the size of the WIC food package. And from the chart on the right, you can see that the racial ethnic diversity of families served by WIC is quite diverse. Of course, this will look different in every city and county and state, as it should. We cannot ignore the significant inequities in birth and health outcomes that are experienced by our African American and our Native American women compared to white women in this country. We have data that show that WIC investments actually improve birth outcomes among these groups and do help narrow the gap, but we must do more. We must be deliberate right now in our efforts to ensure WIC access to low-income members of all of our communities. Excuse me. This means diverse outreach strategies. This means hiring staff from the communities we serve and being intentional, very intentional in our efforts to increase cultural humility, cultural sensitivity of all staff and all participants. I actually think WIC has historically done a very good job at this. We have been a leader in having diverse staff, and it's now is time to continue these efforts. Our agency, PHFE WIC, has promoted one of our nutritionists to be a health equity manager. We actually did this 4 years ago. And in November of 2020, we posted our racial and health equity progress report on our website, phfewic.org. And I commend National WIC Association. They have identified health equity champions across the United States and have launched the Ahead in WIC initiative, advancing health equity to achieve diversity. These efforts are essential. They merit national attention, and frankly, they merit national investment. So thank you. I couldn't be more proud of the WIC community. I love what I do. I love this WIC family. And I thank you to all of you on the front line for everything you do every day to improve the health and well-being of the 6.3 million participants that we serve. I welcome your questions, but for now, I'm really eager to hear the rest of our speakers. And Brian, let me pass it back to you.
Thank you so much, Shannon, for all of those incredible thoughts and resources that you put out. It's now my honor to introduce Peggy Truba, our state WIC director in Nebraska, who has been shepherding her state through the COVID-19 crisis. So Peggy, take it away.
Thank you, Brian, and thank you to NWA for inviting me here today to share Nebraska's perspective and experience as we responded to the COVID pandemic. Next slide, please. So before I get started, I want to talk a little bit about Nebraska and the WIC program and give you a little background. Nebraska is a geographically large state with a small but somewhat diverse population of 1.9 million. We have two major urban areas, one in Omaha and one in Lincoln, which is our state capital. And the rest of the state is mostly rural with a majority of really small towns, but a handful of mid-sized cities as well. In Nebraska, we serve just under 35,000 participants monthly, and direct WIC services are provided by our 13 local WIC agencies, who are made up of local health departments, community action agencies, and other nonprofit agencies. And those agencies operate about 100 clinics across the state, and they provide WIC services with about 150 staff who are a mix of full and part-time, and those staff often share their time with other programs, such as the immunization program. The state agency operates with about 11 full-time staff, and we also share staff with another program. In Nebraska, we implemented EWIC statewide in November of 2018, and we operate an online EBT system. Next slide, please. So in Nebraska, we started receiving questions from local agencies in about late February to early March about COVID. And I've heard during this conference that other states were receiving their questions even earlier than we did. Our local agencies raised quite a few questions that presented a lot of new challenges for all of us. And for example, I'll just tell you about a few of them. They said, how could they change their clinic layout and their clinic flow to maintain social distancing? How could they continue to measure anthropometrics and complete blood work safely? How could they use telehealth services and other options for nutrition ed visits? And at that time, Nebraska was not providing any telehealth or video services. How could they share information with their families without a texting system? And that's because we were in development with our texting system, but we had to put it on hold just before the pandemic. How could the state help them with staffing shortages that they anticipated that could happen? How would we all complete our monitoring and our authorization of our WIC vendors this year? And how would we as a state be ready for a lot of new families if those families applied because of the economic impact of the pandemic? So our local agencies were pretty prophetic in thinking about what might happen to them over the course of time. And it was clear from the questions that they asked that there were a lot of challenges ahead. And we needed more flexibility to be able to offer options for services for our families and for our local agencies. So we started off by looking at the kinds of changes that we could make within the federal regulations. And we asked our FNS regional office for guidance. They sent us the existing policy guidance on providing WIC services during disasters and pandemics. And that was based on meeting federal regulations. So to us, the guidance was not entirely clear about when physical presence wasn't required, and that generated a lot more questions. There wasn't any guidance at that time about waiving other federal requirements. But that changed in just a few weeks with the signing of the Families First Coronavirus Response Act. And thankfully, WIC waivers were permitted, and FNS quickly put an online waiver application process in place. And there, each state could apply for waivers. So Nebraska applied for and received our first waivers to provide remote services. And we quickly, at the state level, got the guidance out to local agencies, and remote services were able to begin in Nebraska on March 25th. So then once that happened in April, we turned our attention to the more administrative areas of the program, and we applied for additional waivers. We applied for a waiver regarding whole grains, specifically to expand the size of the package size of breads. And we also applied for additional waivers for local agency monitoring to do that remotely. Also to remotely monitor vendors and for an extension on our vendor contracts. So with waivers in place by the summer, staff were more comfortable delivering remote services, but we still had challenges. The next challenge we all struggled with was planning for and managing the uncertainty of what might happen when the waivers ended. And we didn't know how long they would last and when they would end. So we had to make plans for how services could be delivered in a variety of ways that were both convenient and safe for our families and our staff. But at the same time, our families and staff were telling us they wanted to be able to continue to provide remote services and receive remote services. Fortunately, in October, the continuing resolution allowed us to maintain those waivers and continue to provide services remotely. And since that point, we've been monitoring our trends and planning for an eventual return to in-person services. And that includes WIC staff getting their COVID vaccines as essential public health workers. Next slide, please. So in the next couple of slides, I'm going to walk through some of the participation trends that we've seen in Nebraska. This is our participation by category, and to define participation, that means the number of individuals who are enrolled in the program who received benefits. And typically we talk about that on a monthly basis. Nebraska's followed the national trend with 10 years of declining participation. And that changed for us in April of 2020 when we saw our participation start to increase. As Shannon mentioned, we saw that change in Nebraska, only not quite as large as they saw in Los Angeles. The need experienced by our families as a result of the pandemic and the flexibility that we now had to offer remote services in the program really has turned this around for us. This is a huge change for WIC. We would not have been able to meet the needs of our families or have seen the changes in participation without the flexibility that we saw through the waivers. So this slide also shows that in Nebraska, we are now also serving a larger portion of children than we were in prior years. Next slide, please. This slide looks at enrollment, and enrollment is the number of individuals who've been certified and they're eligible to receive benefits. And Nebraska's enrollment follows the same trend as participation. We were seeing a steady decline until 2020 when it started to turn around for us in April. Next slide. This slide is looking at the percent of individuals who were enrolled and eligible for benefits who actually participated, meaning that they received their benefits. And not everyone who's enrolled receives benefits. They may miss an appointment. They may not be able to show up. So for us, this percentage was pretty consistently around 85%. And although it doesn't look like much of a change, we moved from 85% to nearly 90% during 2020 and 2021. And that is a huge change for us. Our MIS system doesn't have the capacity to automatically issue benefits from the state. And I've learned this week that some of you are able to do that, which is great. So benefits in Nebraska are issued by the local staff to individual families through the appointments that they keep. And although I don't have a graph, we have heard from staff though that the no-show rates for appointments have also significantly decreased, and more families are keeping their appointments now that they're able to come to those appointments remotely. Next slide, please. So we know the future will not look like the past for Nebraska WIC or for WIC nationwide. We were forced to move very quickly from mostly in-person services to remote services for all WIC appointments. But we're very thankful that we were able to do that. In Nebraska, we experienced a lot of challenges, and we quickly realized that we need to make a lot of improvements, specifically in the area of technology infrastructure, so that we can deliver services that meet the needs of our families into the future. Our families tell us that remote services are more convenient, and they appreciate the safe and easy option of their remote appointments. Staff tell us that families more often keep their appointments, and they are more attentive when they are present at a remote appointment. So we want to be able to continue to offer those options for our families. To move forward successfully, we definitely need to invest in technology. We need technology options to accept documents from families that are easy, consistent, and secure. We need technology options to communicate and share information with our primary care providers. And we need better technology options for video conferencing appointments. And then of course, we need to offer training to WIC staff so that they're comfortable using all of this technology. We have a lot of flexibility now, but once the waivers expire, we will be returning to those statutory barriers that require an applicant be present in person and that limit the way we can offer remote services. We're all concerned about that impact on our families and on the program if we no longer have the option for remote services. We also need modern solutions for the shopping experience. The waivers gave us a few options to help address areas such as product shortages, but we definitely need more solutions. And with that, I'll turn it back to Brian.
Great, thank you so much, Peggy, for walking through Nebraska's experience. And I think there are a lot of broadly applicable lessons coming out of Nebraska's experience that applied across the board. So to hear from our frontline folks, I'd love to introduce both Safa Hamad, who is a WIC program manager in Raleigh, North Carolina, and then followed by Lexi Stone King, who is a registered dietitian working in Des Moines, Iowa, both of whom can speak to what participants are facing as they navigate the COVID-19 crisis. So Safa, let's get started with you.
All right, thank you. Good morning, everyone. So you've heard the experience in the clinics and the increase in participation. So I am going to share the local perspective from Wake County in Raleigh, North Carolina, we are the second largest program. We serve currently 18,500 participants a month. Before the pandemic, we were at 14,000 a month. So it has increased greatly in our area. I would like to share with you that with the COVID-19 pandemic, it has exacerbated the differences in the WIC shopping experience for WIC participants. And just like everyone else saw shortages of items in March and April, you would see the shelves are empty when you go and try to purchase your items. And as Brian mentioned in his comments, that this is a prescribed food package. So they have to have a certain type of food, a certain size of food. So when people were panic buying, the shelves were empty and our participants were not finding what they needed. And currently we still have these problems from our clients. They are telling us they can't find certain formulas, they can't find certain cereals or milks because people are still purchasing these items. And one thing we've noticed is that even though we are hearing from families, we're increasing in participations, but we're not finding that redemption. The redemption is not matching the participation. So participation means they come, they get their, they do their certification remotely like the other agencies, but they're not actually going to the grocery stores. It's not matching that. So of course, they're not going to the grocery stores for the same reason you are not going to the grocery store. It is because you're afraid to increase your family's risk at getting COVID-19, especially for our mothers that are pregnant or new moms with infants. They don't want to be going to the grocery store. So we do know that there are some shopping innovations that vendors are working on, and some other USDA programs, such as the SNAP program. They were lucky enough that they were able to scale up on online shopping and have their clients the ability to shop from different vendors online from home, from their convenience, without having to go into the grocery store. And a lot of times delivery is an option. So unfortunately, WIC does not have this technology ready. And we know here from our county here, we are ready to go. And a lot of our state agency and most agencies around the nation and retailers have done something to make the shopping experience better for their participants or shoppers or customers, just like self-checkout. You can order online, and then you can either go and pick up your groceries curbside, or you can even pay in the store and then pick up. And you can also have someone shop for you, just like all these new vendors that you can just have bring your groceries to your home. So we see this as an equity issue. We would like to have our WIC participants have the same options every other shopper has, that they could also shop online from home and protect their families. Next slide, please. So we really need to modernize the WIC shopping experience. Current actions that are going on, we know the USDA has asked for a shopping task force, or a WIC online shopping task force, which they were going to study about how to implement online shopping for our participants. But we really need to make this for everyone a national solution. Also, Congress has asked for USDA to have a 3-year WIC online ordering grant, and by September 2021, they will have some sort of guidelines for technology, and especially for implementing WIC online transactions So as I said, that we know that our families are telling us that we really want to shop like everyone else. We want to have the opportunity to be at home and shop and protect our families. And even though there are some things going on, but we really need to do this immediately for our families to find a national solution for purchasing for all WIC participants to ensure that they're having an equal opportunity to a good shopping experience. And I will answer questions at the end. I will introduce Lexi, sorry. Lexi is going to also talk about their perspective in her agency.
Thank you so much, Safa. My name is Lexi Stone King. I am a registered dietitian with Polk and Dallas County WIC agencies in Iowa, so smack dab in the middle of Iowa. And I have the pleasure of working one-on-one with families on a daily basis, completing their WIC appointment. So as most people experienced when COVID kind of hit, our agency had to shift pretty quickly to offering services remotely. And we really wanted to make sure that no matter what, when we were kind of in this world of unknown, we wanted our families to know that we were still here and ready to serve them, to kind of help them through this time. And we did see that WIC was definitely needed during that time, from February of 2020 to March of 2020. In just that month alone, we had a caseload increase of about 7%. And February 2020 to January 2021, so almost that year, we have seen a sustained increase of about a 10% increase. So families have needed WIC due to the economic impact that has been had, but we're also noticing that the ease of the remote certifications with the physical presence waivers, it has become more convenient for families as well, which is so needed in this time when there's so much stress going on in their lives. We compared our data from January 2020, when everything was offered in person, to January 2021, when we were doing everything over the phone, and we saw a decrease. It was about 53% less of missed appointments and kind of that no-show rate, which means we were able to provide a continued care for our families. So as I mentioned, when everything started to pivot, our main priority was we got to figure out how to let our families know we are still here for you when everything's going on. And thankfully, our agency had some technology pieces in place that we were able to utilize. So our primary was social media. We kind of had a big blast that we are here for you. We're still open. We're offering services. So we were able to utilize that. And then actually, we've been able to utilize that through this process when we're not able to see them face to face. We've been able to do lives and giveaways. So that way they still feel connected to us at the WIC clinic and not so isolated. We kind of streamlined our certification process, or not certification, referral process with providers. So that way, if they knew of a family, a doctor, another resource agency, that agency can let us know that a family is in need. And we very much streamlined that process to make it easier on mom and the family. And then the last area that we really worked with to let families know we're still here is our beautiful website. So families were able to apply online, schedule appointments, and submit all documentation. They used to have to bring that to the clinic for their appointments, but since we're not seeing people, we had to figure out an alternative method. So we used our website, and they could do everything just via that website there. And with our website, we have seen in the past 5 months about 1,400, a little over 1,400 appointments have been scheduled. So that ease of access with that technology piece has been key for families. And so what it looks like for our families right now when they have an appointment, they used to come to the clinic, we'd go through anthropometric data, some nutrition education, and some of those pieces are currently missing because we don't see them in person. But we continue to focus on every appointment over the phone. What we're good at is that nutrition education piece. So we will walk through a bunch of processes with mom over the phone, answer any questions she has. But sometimes in the clinic, when they came to visit us, we were able to give them like hands-on, here's a flyer, here's some more information. And that piece is missing remotely as we do these over the phone. So thankfully, our agency had a texting system in place that we were able to utilize. So if mom had a question and wanted more information, we were able to navigate to our texting system, which every staff member has access to. We have a full arsenal built out as far as the different topics and different more specifics. So with just a few clicks of a button, we are able to send mom a link to her phone via text message for more information. So we can provide that, but also meeting mom where she's at. She's got it when she's ready, and continue to follow up on that information. So I talked about it a little bit. One of the pieces of the appointments is the anthropometric data, the height, weight, lead, hemoglobin levels. That is a piece that we are missing with remote certifications because we don't see the kids in the clinic. However, we have been able to partner with doctors and things like that to gather this information. Mom can look at her online medical records and get us that information. So even though we at the WIC clinic may not be gathering that information anymore, we have strengthened our partnerships with the doctors to ensure that that child is being monitored. Those levels are being making sure that they're where they need to be. And again, if mom is not seeing a doctor regularly, that's where WIC comes in as the resource system that we are to make those referrals. So while we would love to see the kiddos to gather that, as long as it's being monitored, we feel comfortable. And then that allows us to really focus our time on the nutrition education that mom is really needing. And same thing with breastfeeding support. We are doing everything over the phone. We've got those links and videos. Some agencies and states have experimented with teleconferencing platforms. And then we also have an arsenal in place of referrals that we can make as moms are needing. Next slide, please. So what this is going to look like post pandemic and once the waivers end. In our agency, we're really nervous about what this is going to look like because we know that once the waivers end, it's not like a switch is going to be flipped and the pandemic is suddenly over. We know that our families are going to be dealing with these effects for quite some time. I had the pleasure of working with a mom just actually this past Monday for one of her appointments, and she was asking me about what the future of WIC looks like when she's going to have to come back with that with her kiddo. And I will never forget, she used the word terrified. She was terrified to bring her child out. And she told me if it meant that she had to bring her child to the WIC clinic, she was going to terminate WIC services because she was not interested or willing to put her child at risk. So she was relieved to know that we had these waivers in place. She felt heard, she felt understood, and she felt that we were putting her family's safety at the top level of priority, which as a public health system is what we want to be doing. And there's going to be other challenges in place when we open back up. We know that, like I said, it's just not going to flip a switch. Everything's going to go back to normal. Each agency is going to have different issues as far as bringing families back in. My agency specifically, our contract is held by a hospital, which means that we have to follow the visitor restriction issues. And so that might mean a mom can only bring in the child whose the appointment is and not be able to bring any of her other kiddos. And that might mean she has to decide between coming to the WIC clinic, or she might have to find a babysitter for those kiddos, or just other barriers. That's going to make it even more difficult because we are still experiencing the effect of the COVID issues without having these waivers in place. So we are worried that our numbers are going to drop. We are worried about what it's going to look like serving our families because we know that they're still going to need us and our services. And we don't want to have to ask them to choose between their WIC benefits and their family's safety. And for those, we do have families where WIC is the difference between having dinner on the table that night and not having anything. So it is not fair to make them come to the WIC clinic, when they have got, these concerns. So we are hoping that the waivers are going to continue, but we're also in a unique position this year, as Brian had mentioned. 2021, we've got some opportunity with the Child Nutrition Reauthorization Act of good that it can do. And I'd be happy to answer any other questions about what it looks like at the local level, but with that, I will pass it back to Brian.
Okay, thank you so much, Lexi. And as a few of our speakers have mentioned as well, I would love to just flag the State of WIC report. That is a centralized resource, definitely can explore a lot of the issues that came up in the presentation today in further detail if you have the opportunity for some further reading. The State of WIC report covers a host of issues, including the evidence base for WIC's effective outcomes, our program's COVID-19 response, an overview of WIC's nutrition services and the scientific basis of our food packages, collaborations to enhance access to the program, streamline the clinic experience, and partner with healthcare more effectively, the attempts to innovate a more modern shopping experience, to strengthen equity throughout the program and partner with healthcare to address those significant challenges around racial disparities in maternal, infant, and child health, and our efforts to partner with agriculture and farmers markets to contribute directly to the local farm economy as well. Throughout the report, there are testimonials from frontline providers that provide that in-district frontline perspective of how WIC is operating and where we need to move forward as well. So it's a critical resource, and we just dropped it back in the chat again. So if you want to click on that link, we hope that you utilize it in the weeks and months ahead as you consider future action, both through COVID-19 response and the regular forms of legislation as well. So with that, I'd love to just move forward to our question and answer session. So if I can invite our panelists to turn their videos back on. And if you do have a question, please feel free to drop it in the chat or direct it directly to my colleague Chandra, who is the host for the event, and we will get to the questions. So the first one is directed towards Shannon, but of course, if others want to weigh in, please feel free to do so. You mentioned an opportunity to double the value of the food package. How would that come about? Is that a Congress or a USDA question?
Well, Brian, I'm delighted you're asking me, but I would probably ask you that question as the expert on how it would actually happen. I can tell you about the strong science behind it and why we should do it. And I'm gonna punt it back to you because I think the mechanism through which we can get from the food package we have now to one that's twice as big is going to be really led by NWA, USDA, and other efforts. So could I invite you to weigh in on this important question?
Sure, of course. It is something that can be accomplished through USDA rulemaking, but of course, as WIC is a discretionary program, we want to ensure that Congress is moving along and in tandem with USDA if there was an increased value. But I do think, and Shannon, if you want to take a moment to just talk a bit about what it would mean for the diets of WIC families and their ability to have improved health outcomes.
Certainly, that part I feel a little more confident in commenting on. I think what the 2017 food package did, I'm thinking I'm having a little bit of tech slowing here, so hopefully you all can still hear me. What the 2017 recommendations allow, and those are released in January of 2017, was a nicely scientifically aligned WIC food package that improved balance and choice of our current packages. The 2009 changes brought those wonderful fresh fruits and vegetables, canned and frozen vegetables, fruits and vegetables, hooray, in any form, as well as whole grains and lots of new options. And what the 2017 recommendations do is really try to increase balance and choices for participants so they have more opportunities, for example, to substitute some of the juice for more fruits and vegetables. That committee that I was really delighted to serve on was constrained by cost neutrality. And what that meant was that the decisions that we could make were constrained by not being able to add any more value to the food package. But there's ample scientific evidence that more is better. And when you look at a $40 food package, doubling that would mean so much to a family making less than 100% of the federal poverty level, like I showed you in the slides before. This is an equity issue. We absolutely have to increase the value of the foods. These are healthy foods. We're giving wonderful foods, and frankly, they're foods that are out of reach from a cost perspective to many families. So I invite other panelists to weigh in, or I'll kick it back to you, Brian.
Thank you, Shannon. Another question, which I guess can be addressed to all of our panelists. I appreciate using technology and meeting families where they are, but how do you balance the in-person contact and monitoring that is also a key part of serving WIC participants with virtual appointments, et cetera? What is a good balance to allow for both post-COVID?
This is Peggy. I'll start. I think Lexi mentioned that working partnership that we have with our primary care providers is a really good way to be able to facilitate that and make sure that that happens. You've got good heights, weights, hemoglobins that you can use, as well as any other information you might need from their care provider to be able to monitor the growth and health. And then, the remote access allows us to have good conversations that are maybe a little less distracted and a little more focused. And so I think a combination of referral information and remote access, and some of our families actually do want to come in and see us. They like seeing us. So I think that combination and that flexibility is really key.
I can share a little bit as well. I think Peggy, you said it exactly right. That flexibility is key, and meeting families where they're at and what they're wanting. So I know at our clinic, we did have a piece built in before COVID actually hit, where families did have an option to complete some of their appointments online. Some of the appointments, they are still required to touch base with the WIC clinic. Normally that would have been in person. Right now it is over the phone. But so we are still seeing them and connecting with them in some way, shape, or form, but it allows mom and the families the flexibility to make it work on their schedule, as some are more tech savvy and feel comfortable in that space. But we do have those families who they've got a connection with the WIC clinic and they love connecting with us. So leaving it in mom's court a little bit as far as what she likes in that flexibility piece, but we do have those processes built in where we are still connecting with families, throughout the year and their certification.
And then just a follow-up question came in on that point, and exciting to hear WIC partnering with doctors to obtain and share relevant health information. What specific challenges do you face in working and building those relationships with providers?
I can maybe talk a little bit about this one too. I know we have strengthened that over COVID. I think because doctors have really realized that, partnering together serves the outcomes our family the best. But some of the challenges are their clinics are extremely busy and overwhelmed as it is as they're navigating the COVID and how to serve their families. So it's figuring out how we can continue to serve our families well in our own clinics, but then partnering together. So it does always come down to time and resources and technology pieces that we have in place, because the more some of that we can have built out and the easier we can make it, the better it is. But I would just say overall time and resources on both ends can make it difficult to connect with providers.
Brian, I would like to also share that within Wake County, we did get a lot of flexibilities, but we also still have to do things like get a prescription from the providers to make sure when we issue a formula specific to an infant or a mother or a child. So that has that takes a lot of time because you are trying to reach the providers, just like Lexi said, and they are as busy as we are. So we actually have a full-time staff work 8 hours a day just doing prescriptions for our 18,500 participants a month. So it is a full-time job. So they just keep on trying to reach the provider, trying to get that faxed in, make sure everything is complete and full. So we have these relationships. We always do outreach to the providers in the community, but we also have technology within Wake County where we can look at health information exchange and see what a doctor has put in, if they visited a certain pediatrician or a OBG. So sometimes we have that information already, but still we need to get that new fax in for the new prescription.
Great, thank you all for your answers. Another question here. Have your low-income/rural area clients experienced any setbacks with technology or internet to utilize the services reviewed? If so, how have you overcome these barriers?
Well, I can start off there. Definitely, yes. Reliable internet service, And even, the minutes on the phone and phone technology are definitely barriers for our families in rural areas, but they can be in urban areas too. Many of our clinics still offer the option for folks to come in and drop off documents, and they've got ways to set that up to do that safely. They can send in pictures. If they happen to be using a video conference, they can look at those documents, but the video conferencing can be limiting too. So I think, again, a variety of options, and always offering, if you need to drop it off, or if you need us to work with you to find a way to do it, that's just what we have to do, because our families have a lot of barriers and they have a lot of things going on in their lives, and we try to make it as easy as we can for them and as safe as we can right now.
And then I guess we'll end here with a lightning round. What would be the top recommendation from each panelist that would be the most effective way to accommodate for the influx of families due to the pandemic? And I guess let's go in order. So Shannon, let's get started with you. But Shannon may be frozen right now.
I'm back. You're
Okay.
so patient with me. I'm so sorry. One, Brian, that's really hard. So, I have about 10. So I'll stay in my lane, and I know the rest of the three of you will probably say all my other ones having to do with, thank goodness for the flexibilities right now. We absolutely need those, but it's going to be about food package. I think our families, what we're seeing is that they really appreciate the flexibility with fruits and vegetables. It's one of the most redeemed items. And I really think we need to keep fruits and vegetables at the front, and it's really valued. And getting that to the $35 you talked about at the beginning, Brian, let's do this, and let's do it for more than 4 months. Thanks.
Thank you, Shannon. Peggy?
Well, I think I mentioned technology about 6 times in my presentation, so I'm going to say technology. We're a little bit behind here, and there are lots of ways that we think it could be really effective. We use the phone mostly for appointments now, and I think having options for video technology and document drops and that kind of thing would be extremely helpful for us moving into the future.
Great. Safa?
So if you don't mind repeating the question, Brian, so I will just make sure that I reply accordingly.
Or what is your top recommendation from each panelist that you would say are the most effective ways to accommodate for the influx of families due to the pandemic?
So again, I would say I would love for the technology to be updated as well, just like Peggy said, and to allow the flexibilities to continue, because we know this pandemic is not going to end very soon, and all our participants are not, at the front end for receiving the vaccinations. And I would like these flexibilities to continue moving on, because we're going to get something in the future that's not COVID-19. It might be COVID-20 and so forth. So I think that if we can establish some sort of system where flexibilities are existing, but at the same time we ensure quality certifications and consults with the clients, and make sure that they can do the same thing every other person does, which is shop online, that would be an amazing thing.
Great, thank you, Safa. And then Lexi, why don't you round us out?
Perfect. So technology was said, and I'm going to echo that, because I think technology opens so many doors for us across so many different areas that allows us for improvement. But I would say I would love to see continued flexibility with the physical presence waivers. Keeps our families safe, helps them feel more, assured during this COVID pandemic time. But also we've seen how well our families are responding to it, and it allows us better continuity of care. They're keeping their appointments, they're continuing to connect with us, which just allows us to elevate all of the awesome work that we're already doing. So I would say that would be a route that I'd love to see us explore and see more permanent changes with.
Great. So thank you to all of our panelists for joining today, and thank you to all of our attendees as well. We look forward to working with both Congress and USDA to realize some of these changes in the weeks and months and year ahead. I think it's an exciting time for the WIC program as we've been adapting tirelessly during COVID-19, and there's a lot of potential and opportunity for where we can go in the future. So thank you, everyone, and have a great rest of your Friday.
Great job, Lexi.
Thank you, everyone.
Thank you. I was just trying to read some of the chat. I didn't have time.